The beauty of hospice is that it is not one person that's helping you. There's an entire team. So you have the nurse and you have the social worker and you have the chaplain and you have the aide, and they all provide a role for that family. I tell families there are pieces to this puzzle that you're trying to put together. The health factors, the diagnoses, that's all one piece of the puzzle. And then you have the financial piece. One family member is very sick and needs all of this care that's going to cost this money. And you have another family member who still has to live. There's so many pieces. In saying that, Medicare covers hospice at 100%. So that is kind of a blessing in and of itself. But those other pieces of healthcare that cost, and you're trying to navigate that, and then everybody giving their 2 cents about what needs to happen, the frustration, the guilt, the caregiving burden. You love them tremendously, but it's hard to care for somebody 24/7. And letting a team come in and help at that time, it is invaluable. I don't think people truly understand the vast capacity that hospice has to help step in and help. When you hear the word hospice, a lot of times people think death, and they don't want any part of that. But when you list out what hospice does, the support with education, stepping into those spaces where you don't know, providing equipment that you need, a bed. I've been trying to get a bed for 2 years. We can get you a bed in 4 hours. Medicine support, explaining how to utilize those medicines, tapping into other resources, utilizing the social worker to fill the gaps between what hospice does and what you need. All of those things are so, so profound. If I talk to someone and say, do you want hospice? They may say, no, I don't think we're ready for that yet. But if I say, if you had a team that did all of these things, they say, yes. How do I get that? That's hospice. Look at how do we shift the focus not to what hospice takes away, but what does hospice bring to the table? It is an amazing support system for patients and families when that time comes and they need it. For physicians who are getting phone calls repeatedly at their clinic for a family and they don't know how to step in and help, there's a team that can do that.